think originally the statement came out of the blue, I think, as an MHK, and I think from a general public point of view, very little information was attached to that statement. So it's given the minister to add a little bit more detail, because I do have concerns with regard to the current service that's provided by Flybe, and now we're potentially transferring over to EasyJet. But I'm more concerned about how patient transfers will actually work with regard to the steam packet.
Do you think this is a case where using the steam packet, now that it's government owned, that maybe is the more financially viable option?
It's a good question. I'm not sure it is, because I'm sure, given our sailings, the patients may have to travel the night before, so there may be additional cost with accommodation. So what I'm trying to do is just give the minister an opportunity to explain exactly how the new patient transfer service will work, because at the moment people leave via Flybe, they leave the Isle of Man, they're picked up by a taxi in the northwest and taken to their appointment, then they come back hopefully on the same day. So how will that work via the steam packet? I understand how it'll work with regards to EasyJet, because it's a very similar, it's like for like service. So it's more about the cost. Is there any additional cost with accommodation? How can a patient sit on the steam packet for, say, 2.5 hours and still then be picked up and collected and brought back the same day, sort of thing? So I'm just giving the minister a clear opportunity just to give the people who have to use the service and us as the political members just an opportunity to expand on his original press release.
Do you think it's important that it's more about what service works best for the patient rather than how it works in terms of cost and timings wise, that the comfort of the patient needs to come first?
Absolutely, and I've had some dealings with the patient transfer team in recent weeks, and they've been fantastic. I had a constituent myself who contacted me, who unfortunately I did not realise that the patient transfer only really look at Liverpool and Manchester. So this poor constituent had to go all the way down to Oxford, flew to Birmingham, then had to get a train. But unfortunately, the train, not due to any fault on the Isle of Man, that the train was full, and they had to stand for 2.5 hours before getting into Oxford. So it is about the patient comfort, because they're in enough anxiety at that particular junction. So we've got to make sure that if we're asking people to go across for service, for health service or checkups, then we make it as comfortable as possible.
Would you like to see that change then to make it available for patients to go to whichever airport is nearest to the hospital they're going to, not just one in the northwest?
Absolutely. I think we've got to try and line this up a little bit, because we've obviously got a review going on at the moment into our hospital, and it may be the case that additional services may have to be delivered off the Isle of Man. So if we are going to be delivering more services off island in the future, then we do need to make sure that the service is there to support patients who unfortunately have to leave the island for those services.
You've already mentioned one constituent there, but have you had feedback from others as well? Is this something that is a concern for the public?
I think I've witnessed it myself a couple of times when I was in Manchester. I did see a group of patient transfers just being left in the lobby of Manchester Airport, and I did approach them and ask them if everything was okay. So it is about, if you are having to go across to the UK for services, then it should be from a door-to-door service. We should be we have a duty of care to look after those patients from the moment they leave home to the moment they come back.
There has been, with regards to Flybe, a little bit of uncertainty about the future there over the recent months. It seems to be becoming a bit more clear now, but there's talk of changes to timetables and things like that. Is it important that patients do know exactly what's going to be happening?
Yeah, I think the department, that's maybe something I will pick up with the minister on Tuesday next week. It's about giving the clarity. I mean, as you say, when people are having to leave the Isle of Man to go away for treatment or for a checkup, it is an incredibly difficult and stressful time for those individuals involved. We've got to make the process as easy and as transparent as we can.